Vanakkam, good morning. In this video, we are going to discuss about the male sexual acts. In the male sexual acts, erection is controlled by the parasympathetic nervous system. It is originate from the S2, S3, S4 segment of the spinal cord. Through pelvic nerve, it is innervated to the corpus cavernosa. Corpus cavernosa. So it produces the vasodilator effects because it releases the parasympathetic nervous system releases the acetylcholine. It acts on the acetylcholine receptor. It produces the vasodilatation. It produces the nitric oxide. Nitric oxide increases the cyclic GMP. So it produces the relaxes the corpus cavernosa. Same time it block the venous drainage system. So engorgement of the penis is occur. This is called as the erection. The corpora cavernosa in the penis play the important role in the erection. This is a enlarged view of the small part of the corpora cavernosa. This is the deep artery of the penis. The stimuli for the erection is the sights, thoughts, emotions, and sensory receptors present in the penis. These stimuli activate the parasympathetic nervous system through the pelvic neck. It is originated from the S2, S3, S4 segments. It releases the acetylcholine. Acetylcholine acts on the acetylcholine receptor in the deep artery of the penis. It converts the arginine to the nitric oxide and citrulline. Nitric oxide acts on the guanyl cyclase. It converts the GTP to cyclic GMP. It produces the relaxation of the smooth muscles corpora cavernosa. So the arterial dilatation and the corpora cavernosa relaxation, it increases the blood supply to the corpora cavernosa. It is play the important role in the erection. Same time it block the venous drainages. It is maintain the erection. It is play the vital role in the male sexual acts. Viagra is the drug commonly used for the erectile dysfunction. The pharmacological name of this drug is sildenafil citrate. It inhibits the phosphodiesterase. The erection is mainly due to the pelvic nerve releases the acetylcholine that releases the nitric oxide. Nitric oxide acts on the guanyl cyclase. It converts the GTP to cyclic GMP. Cyclic GMP then converted to the 5 days AMP. This cyclic GMP is important for the erection. So cyclic GMP is converted to the 5 days AMP by phosphodiesterase. So the sildenafil citrate, Viagra prevent the breakdown of the cyclic GMP. Cyclic GMP. So cyclic GMP is converted to the 5 days AMP. So it is mainly used for the erectile dysfunction. Normally, sperm stored in the epididymis and proximal part of the vas deferens. During the emission is the process during which the sperm is move into the urethra. So emission is controlled by the sympathetic nervous system. It is originated from the T12L2. It is innervated through the hypogastric nerve. It is act on the epididymis and vas deferens. The sympathetic nervous system releases the norepinephrine. It produces the vasoconstriction. So it moves the sperm to the epididymis vas deferens to the seminal vesicle. Seminal vesicle is secretes fructose and other fluids, seminal fluids. It is moved through the common ejaculatory tract to the urethra. This place in the prostate also secrete the prostate secretion. So the 70% of the semen fluid is contributed by the seminal vesicles. 10 to 20% is contributed by the prostate. These are enter into the urethra. The emission is the process of the sperm move from the epididymis, proximal part of the vas deferens to the urethra. It is controlled by the sympathetic nervous system. Sympathetic nervous system act on the vas deferens, seminal vesicles, and it is trained into the urethra. Ejaculation is the propulsion out of the semen from the urethra is the ejaculation. So semen is coming out of from the urethra is ejaculation. It is controlled by the pudendal nerve. It is originate from the L5S1 to S3. This is a somatic nerve. It is controlled by the spinal reflex. So center is the L5, S1, S2, S3. So pudendal nerve causes the contraction of the pulbo-cavernous muscles. So it is helpful for the propulsion out of the semen from the urethra. So ejaculation is controlled by the pudendal nerve. Thank you for watching this video. If you like this video, press the like button, share your friends. Those who are not subscribed this channel, please subscribe. These videos briefly discuss the physiology topics. You must read the physiology textbooks. Thank you once again.